Hello, this is Angelia, and you're listening to or watching the podcast, Why You Do What You Do. The podcast that talks about human development and psychology to try and maybe help you figure out a little bit more about why you do what you do. And yesterday we were talking about age-related, problems. We're all going to get there. And so we're going to, take up on that again. In these and other activities, knowledge based on experience may more than make up for physical changes. So things you've learned over the years and experienced has a little more staying power than the physical things, because it's something that you do by rote. It's something that you just know. So it's not something you have to think about or try to do. Skilled industrial workers in their 40s and 50s are often more productive than ever, partly because they tend to be more conscientious and careful. And that's the thing, that older folks are known for in middle age, that you're more conscientious and careful, whereas younger folks are more reckless and, not so careful and not paying as much attention to detail as they should. That's something that comes with age. Middle-aged workers are less likely than younger workers to suffer disabling injuries on the job. And again, because they're being careful and, respecting their body's cues and clues and limitations, whereas younger folks might not necessarily. A likely result of experience and good judgment, which compensate for any lessening of coordination and motor skills. Because, wisdom comes with age, is the old saying. You learn what you can do and what you can't do and what's safe and what's not safe. So, structural and systematic changes. Changes in appearance, often reflecting changes in body structure and systems, may become noticeable during the middle years. And of course, all of us are going to change our looks. It's just a fact of life. By the 5th or 6th decade, the skin may become less taut and smooth as the layer of fat below the surface becomes thinner. Collagen molecules become more rigid, and elastin fibers become more brittle. So yes, we're going to get wrinkly. This stuff's going to start sagging. I have good genetics. I have a grandma that didn't get a wrinkle until she was 78 years old and didn't even start going totally gray until she was around that age. So, I'm lucky, don't hate on me. So we all age at our own pace. Hair may become thinner due to a slowed replacement rate and grayer as production of melanin, the pigmenting agent, declines. And I've noticed my hair has become thinner. And yes, I'm getting some of that glitter in there too that my husband's got. That's I heard that in a little thing somebody said one time, that it's not gray, it's glitter. And I'm like, oh, okay, I like that. We're getting glittery. People perspire less as the number of sweat glands decreases. And that's why older folks dehydrate so easily, because we don't sweat as much as younger folks do. So we get dehydrated easier. They tend to gain weight due to accumulation of body fat and lose height due to shrinkage of the intravertebral discs. So yeah, we get wider and shorter. That's unfortunate, but that's a fact of life. You would have to eat a negative calorie diet. Actually, one of the doctors told my mom she would have to eat less than 1,000 calories a day in order for her to lose weight. And he said, that's not healthy, so no, we're not doing that to you. And I know my discs, I have degenerative disc disease, so I know I've gotten a little shorter than I used to be, and I think my husband has too. So it's just something that's going to happen to you as you get older. Bone density normally peaks in the 20s or 30s, so that's the time your bones are the healthiest. From then on, people typically experience some net loss of bone as more calcium is absorbed than replaced. causing bones to become thinner and more brittle. And that's why, your doctor is liable to put you on calcium to kind of keep up with the bones so you don't get osteoporosis. Bone loss accelerates in the 50s and 60s. It occurs twice as rapidly in women as in men, sometimes leading to osteoporosis. And if you're a short, slight woman, then you're more likely to get it than anyone else. So if you are, you might want to go to your doctor and keep an eye on that. They can do the little, bone density test. Bone loss can be affected by lifestyle factors earlier in adulthood. Of course, exercise, calcium intake, that all, helps your bones be healthy. Smoking, alcohol use, and a poor diet tend to speed bone loss. So, if you're doing any of those things, now might be a good time to cut them out so that you can keep your bones up into your middle age. It can be slowed by aerobic exercise. They have me doing my little bone strengthening exercises every day. I got 15 minutes of stuff I do to make sure, I'm not falling apart, because I have osteosclerosis, which is bad, and some myelofibrosis. I went into, my doctor said full remission, and it was down to 10% from 24% over cell size. So, but now the last time it was 12. So you might send some prayers up for me that it stays low and not back up, because that's where it gets dangerous. Resistance training with weights, like I was talking about the other day, get you some little weights, and work on that, keep those bones strong. Increase calcium intake and vitamin C. Joints may become stiffer as a result of accumulated stress. And that's because, we have the cortisol, which not only sits there, but it also will sit in your bones and joints and make you feel bad. Exercises that expand range of motion and strengthen the muscles supporting a joint can improve functioning. And I can tell you it does. I know if I don't do my exercises for a few days, if I'm like got something going on, I'm busy, when I start exercising again, I can feel the difference. Your body will let you know, oh, well, we weren't doing this, we thought we were done. So large proportions of middle-aged and even older adults show little or no declines in organ functioning. So, your organs stay, pretty good in general. In some cases, however, the heart begins to pump more slowly and irregularly in the mid-50s. And that can be because of hereditary heart disease. It can be because of clogged arteries. It just differs. By 65, it may lose up to 40% of its aerobic power. And that's why exercise is so important, because if you don't use it, you lose it. And your heart is a muscle. It's a little muscle pulsating in there. And if you let it get weak, it will get weak. Arterial walls may become thicker and more rigid. And my husband's family, hardening of the arteries, something that runs in their family. His mother has it. She's got, advancing dementia. My husband has a little bit of it. The doctor said that it's not too bad yet, but they got him on the fish oil and the blood thinners and things of that nature to kind of keep it from getting so bad. Heart disease becomes more common beginning in the late 40s or early 50s, especially among men. So it's worse for men, but I'm gonna tell you, women, it's our silent killer. It's one of the upper causes for women as well. So don't let any male doctors tell you, oh, you're a woman, no. You let them check that little ticker out. If you feel like any problems, any palpitations, any pains, you let them check it out. Vital capacity. The maximum volume of air the lungs can draw in and expel may begin to diminish at about age 40 and may drop by as much as 40% by age 70. And now yoga has breathing exercises where you do that. You take in the big breath and you let it out. And you do those, about 7 in a row. And then there's even one which is an expansion breath, where you take in as much as you can and then try to take in more, and that supposedly expands your lungs. So that's something you can do if you feel like your air capacity has gone down. Temperature regulation and immune response may begin to weaken, and sleep may become less deep. Now I know I become so heat sensitive. I mean, I got a rash today. I had a bracelet on, and it started sweating, and I started getting a breakout where that bracelet was on my arm. So needless to say, I took it off. But I know I definitely cannot do heat anymore at all, and very cold. I got a sweet spot now between 60 and 80. You get me colder than that, it hurts. You get me hotter than that, I start to fall apart, having problems. So, that's a thing that definitely happens. Immune response. I have more allergy symptoms now than I had when I was in my 20s and 30s. So that is also a thing that happens. And sleep may become less deep. I wake up maybe 3 or 4 times a night. But I do sleep. Usually it's a positional thing. This hip is hurting, so now I go this way. Okay, now I'm laying this way. Now the back's starting to hurt, so now I gotta go back over that way. So, it's rough. And if it's too rough, I'll take, especially if I have a headache, if my back is hurting very bad, I'll take something to help me sleep. But I don't like to do that unless I absolutely have to. Sexuality and reproductive functioning. Sexuality is not just a hallmark of youth. A lot of people think it is. Oh, old people, I've heard young people say, oh God, the thought of old people having sex is gross. But, it's a fact. It happens. Although both sexes experience losses in reproductive capacity sometime during middle adulthood, women become unable to bear children, and men's fertility begins to decline. Sexual enjoyment can continue throughout adult life. So at some point you're going to go through menopause if you're a woman, and then you can't get pregnant anymore. And personally, I was all too happy to be done with that monthly deal. And sometimes that's why older men have problems, having children, is because the fertility rate has gone down. Changes in the male-female reproductive systems are, still many middle-aged people have concerns related to sexuality and reproductive functioning. Blah. Menopause and its meanings. Menopause takes place when a woman permanently stops ovulating and menstruating and can no longer conceive a child. So, and sometimes, like, when you first start, you'll, have a period, and then you won't have one for a few months, and then you have one again. And I did that, for, 8 months to almost a year, and then finally it stopped, and I was holding my breath thinking, well, that's probably, but then it didn't. So I was like, yes. It is generally considered to have occurred 1 year after the last menstrual period, and that's what my doctor told me. So you've gone without one a year, we're not saying you're through yet. And like I said, my last period was when I was 52, so by the time I was 53, I was like, all right. In 4 out of 5 women, this happens between ages 45 and 55, on average at about 50 or 51. So, I might have been a little late, even considering average. Beginning in her mid-30s to mid-40s, a woman's production of mature ova begins to decline as the ovaries produce less of the female hormone estrogen. So like I said, mid-30s. So that's why I tell people, get married when you're 30. Make sure you'll stay married and start popping those little kids out between 31 and 35. And that's the best time for them to be at peak physical, health through your ova. And also, they say the best parents are mature, folks around age 30, because when you're in 20s, you're still trying to build yourself. You don't know who you are. You got to get foundation under yourself before you pair up with another person and start bringing other little people into the world. And that's the best practices on, becoming a parent. The period during which the slowing of hormone production and ovulation prior to menopause occurs is perimenopause. Now, I remember the doctor saying that you're in perimenopause. Also known as the climacteric or change of life. Such a dramatic word for, like I said, I was all too happy to not have a period again. It's like finally, because any of you women know we ain't having fun during that time of the month. It's not fun. Small amounts of estrogen continue to be secreted in amounts that vary among individuals by the adrenal and other glands. Now, I always had a high estrogen level. I had problems even taking the pill, and there at last they put me on the mini pill, and I was having pregnancy symptoms. I was, swelling, breast tenderness, throwing up, so, I had a problem with that. So I always had a high estrogen level. So, maybe I'm lucky in that regard, that I still am not having as many problems past menopause as a lot of women do. Menstruation becomes irregular, with less flow than before and a longer time between menstrual periods before it ceases altogether. Like I said, you might have one month, and then 2 months you don't, and then the next month you do, and you're like, dang. In women who have hysterectomies, however, menopause comes on abruptly without preparation. And there are women who've had to have hysterectomies, and it does kind of put your body into shock a little bit, because you go cold turkey, so to speak, from your estrogen system, where you got the ovaries and you're having the period every month, and then suddenly it's just all gone. There's no wean off period, so it does make your adjustment a little more difficult. Attitudes towards menopause. At one time in rural Ireland, women who no longer menstruated would retire to their beds and stay there, often for years, until they died. If you can imagine that. I have no use anymore. I'm just going to retire to my bed and, stay there until I die. No. Crazy. This traditional custom may seem extreme, yeah, but the attitude is expressed that a woman's usefulness ends with her ability to reproduce. That was typical in Western societies until fairly recently. And that's a shame that, women were discounted as just baby makers. Men are baby makers too. Why weren't they discounted like that? Sexism. During the early 19th century, the term climacteric came to mean the period of life at which the vital forces begin to decline. Again, age is what you make of it. You only decline if you allow yourself to decline. Menopause was seen as a disease, a failure of the ovaries to perform their natural function. So, every woman in the world caught this disease around age 50. Yeah, I know. People was kind of funny back in the day, weren't they? By contrast, in some cultures, such as that of the southwestern Papago Indians, menopause seems to be virtually ignored. And, most of the time here, except when you hear women play, oh, a hot flash or whatever, it's not the end of the world. It's the end of your ability to have children, but it's not the end of your life. You still have a lot of life left. Go live it. In other cultures, such as those found in India and South Asia, it is a welcome event. Women's status and freedom of movement increase once they are free of taboos connected with menstruation and fertility, because then they're more respected. They don't have to worry about those things anymore, and they can do whatever they want to do, and usually by then your kids are grown, so you have the freedom to travel or whatever you want to do. So in those cultures, it's looked on as a welcome thing, and I agree with that. In the United States today, most women who have gone through menopause view it positively. For many women, menopause is a sign of a transition into the second half of adult life, a time of role changes, greater independence, and personal growth. And you should, take advantage of that, and enjoy your life. Don't be all sad that, a lot of women get that whole empty womb, empty nest thing going on, and, I don't understand that, if I'd had my way, I'd probably had 10 kids, but the situation was not, conducive to that. And, it is sad to me that I can't shrink my kids down every now and then back to little toddler size and give them a big hug and, play with them and stuff like that. But they're, grown men and have their own life, and I'm glad that, I was able to help them to do that. So, how a woman views menopause may depend on the value she places on being young and attractive. And there are way too many women who place too much value on being young and attractive. When I was young, I was pretty stupid in regards to life and men. So I'm glad I'm not young anymore. And attractiveness is skin deep. It changes. What you need to worry about is how attractive you are on the inside. Her attitudes toward women's roles, and I'm a little bit of feminist, as my husband doesn't like so much. But I feel like women can do anything that men can do. Now, if we're in competition, can they lift more? Probably. Can they reach higher things on the shelf? Yes, they can. But as far as, anything else, there's not that much difference. We can do anything that they can do. We might have to do it our way, but, don't let men tell you that you're anything less than them. In her own circumstances, a childless woman may see menopause as closing off the possibility of motherhood. A woman who has had and raised children may see it as an opportunity for greater sexual freedom and enjoyment. And there are people who adopt, even after the age of 50. So, it's not the end, it's just a change, and there are a lot of folks, I see older folks out there holding hands and stuff, and, it's like, aw, and, clearly they may have grown closer during these years. Symptoms and myths. Most women experience little or no physical discomfort during perimenopause. I did not. I had some hot flashes. Oh, yes, I did, in the middle of the night. Just waking up burning. But other than that, not so much. Most common are hot flashes, sudden sensations of a heat flash through the body due to hormones that affect the temperature control centers in the brain. And like I said, they're no fun, and they're very uncomfortable. It's like suddenly you're burning on fire. You just want to hop in the cold shower, but can't always do that, especially if you're out somewhere like teaching. You can't do that. But many women never have them, while others have them continually. Thank goodness I did not have them continually. Thank you, Father. But I just would have one every now and again. But I knew women that I used to work with that would complain, oh my God, be making paper fans and stuff, and Administration of artificial estrogen, discussed later, can alleviate the hot flashes but carries risks. Now, my mother-in-law was on artificial estrogen for years, and then she just finally got tired of it and said, I'm not taking that anymore. But some people have, severe hot flashes and things, and they need that estrogen. But like I said, I always ran high on estrogen, so maybe that's why I'm lucky and didn't have it as bad as some women do. Other possible physical symptoms include vaginal dryness, burning and itching, vaginal and urinary infections, and urinary dysfunction caused by tissue shrinkage. Now, the vaginal dryness, there's this thing called coconut oil. It has sterols, plant sterols. And if you use that, it can keep you not dry, to put it nicely. Burning and itching, vaginal and urinary infections, and urinary dysfunction caused by tissue shrinkage. Excuse me. Now, of course, keeping yourself clean is the best way to avoid infections and things. And like I said, coconut oil can help with that, and there's also antifungals. But you might notice a little urine leakages. You might have to have a panty liner every day, whereas you didn't used to have to. My poor mom, she would have a full on pad, and I know other folks who are wearing the adult diapers now, so stuff happens to you. I'm sorry. Since the hormones most directly linked to sexual desire in both men and women are the androgens, such as testosterone, declining estrogen levels in midlife do not seem to affect sexual desire in most women, as long as intercourse remains comfortable and there are no health-related problems that interfere with a healthy sex life. So, if you're afraid that going through menopause is going to make you not want to have sex anymore, not true. Still, some women do not become sexually aroused as readily as before, and some find intercourse painful because of thinning vaginal tissues and inadequate lubrication. And again, as I said, there are ways around that. They sell KY jelly at every store, I think. So, small doses of testosterone may solve the first problem, and use of water-soluble gels can prevent or relieve the second one. Such psychological problems as irritability, nervousness, anxiety, depression, memory loss, and even insanity have been blamed on menopause. But research shows no reason to attribute mental disturbances to this normal biological change. And probably back in the day that was attributed by men to women, just made her crazy. I know my mom got really mean during menopause. She was pretty nasty. I remember saying to my uncle one day, if I get like that during menopause, just shoot me. I don't want to be that mean. And that wasn't very nice to say, but she was just being really mean. And I didn't have that problem, thank goodness, because I would have hated myself. The myth that menopause produces depression may derive from the fact that women at this time are undergoing changes in roles, relationships, and responsibilities. Because, you're probably going away from being the mom, probably more into your own life, especially if you worked, stayed at home or only worked part-time or whatever to be with kids. You can take on more. You can do more things, without them there. And you might be a grandma by this point. Some people are. I know I have friends who are grandparents. But things do change once you are in your midlife. These changes may be stressful, and the way a woman perceives them can affect her view of menopause. And like I said, change is stressful. A lot of people don't like change. Our bodies don't like change. Our mental states and emotions don't like change. We like our little homeostasis. We like being right where we are. Change is disturbing. So, in general, humans don't like it so much. Taken together, the research suggests that so-called menopausal syndrome may be related more to personal characteristics or past experiences than to menopause itself. So, if you get a little hot and you heard your mom or grandma, oh, hot flash, you might exaggerate that a little bit. If you have a little pain and, like I said, grandma and mom was like, oh, you might exaggerate that a little bit. Personally, I just, like I said, I had a few hot flashes, pretty much breezed through it otherwise, if you dwell on it, think about it, be sad about it, make a big deal about it, that's only going to make it worse for you. In cultures in which women view menopause positively, or in which older women acquire social, religious, or political power after menopause, few problems are associated with this natural event, because it is a natural event. If you're a woman and you are ovulating, you will be getting into menopause at some point in your life. Changes in male sexuality. Men have no experience comparable to menopause. They do not undergo a sudden drop in hormone production at midlife, as women do. Lucky guys. But testosterone levels do tend to decrease slowly after age 60 in many men, a phenomenon that has been called andropause. So there is a thing that happens to men where, once they're after age 60, they start producing less. And that's why they say, men over 60 shouldn't be fathering children, because the increased possibility for birth defects is there. So, luckily for the fellas, it's not as bad for them as it is for us. And that's where I'm going to leave you today. I hope this helped you figure out maybe a little bit more about why you do what you do. Please like and share this educational program so we can spread it around the world. If you would help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. That's all for now. Until next time.